Hello, my name is Tasha Beavers. I'm a neurotrauma intensive care nurse here to talk to you about why it's important for healthcare workers to receive their annual flu vaccines. The U.S. Department of Human Health and Services reports that every year about 5 to 20% of the U.S. population are infected with influenza. The World Health Organization also reports that influenza yearly affects about 3 to 5 million people worldwide and attributes to about 250 to 500,000 annual deaths. Research tells us that healthcare workers should be yearly vaccinated against influenza because it protects the worker from getting influenza, but also because it protects the patient from getting influenza. So I really have two main points. One, yearly vaccinating healthcare workers against influenza protects the worker from getting influenza. And two, yearly vaccinating the healthcare worker against influenza protects the patient from getting influenza. According to the Centers for Disease Control and Prevention, or the CDC, the influenza vaccine is actually the #1 way to prevent influenza. They recommend vaccinating anyone over the age of 6 months unless that person has an allergy to the vaccine or they have an illness that prevents them from getting the vaccine. The CDC also encourages people to be revaccinated every year against influenza because every year the seasonal influenza vaccine is redesigned to protect the individual against whatever viruses are predicted by research to be most prevalent in that influenza year. When you're talking about protecting the patient against influenza, you have to look at how influenza is given from one person to another person. And I've kind of created this narrative, this fictional narrative visual aid that kind of talks about how a healthcare worker can give influenza to their patient. But first, the Centers for Disease Control and Prevention, the CDC, says that influenza is spread through droplets that are released by coughing, sneezing, or even talking to an infected individual. That infected individual can actually give influenza to another person up to 24 hours before they even begin exhibiting symptoms of influenza, and up to 5 to 7 days after the symptoms begin. So Nurse Ann is our healthcare worker in this example. And Nurse Ann decides to decline her seasonal influenza vaccine that's offered by her employer. Later, Nurse Ann picks up her ill child from daycare. Her child has a fever and a cough. And then soon after that, Nurse Ann is caring for patient B. And patient B was recently diagnosed with cancer and is receiving chemo treatments. And she has a long conversation with him about the chemo treatments he's going to be receiving. The following day, Nurse Ann is unable to come to work because she is exhibiting symptoms of influenza, and then a few days later, patient B is diagnosed with influenza A. If you look at this chart, it's kind of a circular chart that points step by step how patient B is diagnosed with influenza A. And what you look at, what it begins with Nurse Ann's decision to decline the influenza vaccine that's offered by her employer. The U.S. Department of Health and Human Services reports that people with long-term or chronic health conditions are at higher risk for developing complications related to influenza. People over the age of 65, people under the age of 2 are also higher risk for developing flu-related complications. So in conclusion, healthcare workers should be yearly vaccinated against influenza, not only because it protects the healthcare worker from getting influenza, but because it also protects the patients that the worker cares for from getting influenza. Many patients that are in the hospital and in the healthcare setting have chronic or long-term diseases. We take care of a lot of elderly patients, people that are over the age of 65, and if you work in a pediatric area, we take care of patients that are under the age of 2. And these are people that are at higher risk from developing flu-related complications. The healthcare worker has a responsibility to the patients that trust them and trust their care to them to protect the patient from getting influenza, and the best way for a healthcare worker to prevent the patient from getting influenza is for that worker to protect themselves from getting influenza. Does anyone have any questions?
Does the flu vaccine have a lot of side effects?
According to the CDC, the flu vaccine really doesn't have a lot of side effects, and most of the side effects that are reported are mild. And usually it's soreness at the injection site if you get the injection for the flu vaccine, or it's nasal stuffiness if you get the nasal vaccination, but severe side effects from the influenza vaccine are actually very rare.
How does the flu vaccine work?
The flu vaccine works by creating antibodies in the individual against influenza, and it takes about 2 weeks for these antibodies to develop. The vaccine protects, when you get the yearly vaccine, it protects against whatever viruses that research predicts will be the most prevalent that year. So that's really why it's important for you to get yearly vaccinated against influenza. Any other questions?
No.
All right. Thank you very much for your time.